Paranoid personality disorder, PPD, is a mental health condition characterized by a persistent pattern of distrust and suspicion towards others, even without adequate reason. People with PPD have an extreme distrust of others and tend to be suspicious, guarded, and defensive. This behavior can cause significant distress and impaired functioning in relationships, work, and social activities. The exact cause of PPD is not well understood, but it is believed to be a combination of genetic, environmental, and psychological factors. There is evidence that PPD has a higher incidence in close relatives, suggesting a genetic predisposition. On the other hand, childhood experiences, such as abuse or neglect, can also play a role in the development of PPD. People with PPD display a range of symptoms that are often associated with this disorder. These include a persistent distrust of others, a tendency to misinterpret the motives of others as hostile, a preoccupation with personal rights and a fear of being exploited, a guardedness and defensiveness in relationships, and an inability to confide in others. They also tend to be overly sensitive to criticism and have difficulty collaborating with others. To be diagnosed with PPD, an individual must meet specific criteria as outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. The criteria include a persistent pattern of distrust and suspicion towards others, even without adequate reason, that leads to significant distress and/or impaired functioning. The individual must also have a tendency to interpret the motives of others as hostile or demeaning, a preoccupation with personal rights and a fear of exploitation, and a guardedness and defensiveness in relationships. Treatment for PPD typically involves psychotherapy, such as cognitive behavioral therapy or psychodynamic therapy. During therapy, individuals with PPD can learn to understand and manage their thoughts, feelings, and behaviors, as well as develop new coping strategies to manage their symptoms. Medications may also be prescribed to manage symptoms of anxiety or depression that may be associated with PPD. Paranoid personality disorder is a complex and challenging mental health condition that can cause significant distress and impaired functioning in many areas of life. People with PPD have a persistent pattern of distrust and suspicion towards others, even without adequate reason, which can cause problems in relationships and other areas of life. With appropriate treatment, individuals with PPD can learn to manage their symptoms and improve their overall functioning.